Hello, everyone. Today we will talk about medical advances. I'm here with Galeana, and we begin with the first advance. The first advance was the vaccine for the COVID-19. I think this is most important because help a lot of people, and in 2020, a lot of people are in his house staying because they are afraid about this type of virus. So the vaccine was something that helped us a lot. The next is the gene therapy for hemoglobinopathies. It's a little hard to say. Well, this is something that, like we say here, help a lot of children because this is a disorder that is in the genes. So the therapy has been discovered that gives suffer. So the potential ability to produce functional hemoglobin molecules, which reduce the presence of red blood cells, ineffective in preventing associated complications. So this is a therapy that helps a lot with trouble with the blood. So it's something that in these years are very helpful. Now the next, pacemaker connected to smartphones. Well, like this say, is traditional remote monitoring of this device is done through a bedside console that transmit data from the pacemaker or this defibrillator to the clinician. Well, the new pacemakers are connected to Bluetooth, enable pacing devices can address disconnect issues between patients and their cardiac treatment. Use it in conjunction with a mobile app. So this is something innovative because the patients can now see his heart rate with an app in his cell phone. So to be better understand their pacemaker health and data and transmit the health information to their physicians. The next is endoscopy robot. So first, the endoscopy is a procedure in which a small camera with a long wire is inserted into the body through a natural opening to look for damage for its objects or traces of disease. It is an uncomfortable and delicate procedure that could also be a thing of the past. So this capsule is a new improvement that perceived by companies like Medineering using flexible robots that can be driven like a RC car to the exact spot the doctor needs. So this capsule is something that the doctors can control inside the bodies with something with a control that can be held for getting the places in the body that it's hard to get in. So this is something very innovative that can help a lot of people, and the surgeons can save more lives. The next is the experimental vaccine against chikungunya. During the 2021, the Lancet magazine reported on the clinical trial of the first phase of the vaccine against chikungunya, a viral disease that is transmitted by the bite of a mosquito. There is currently no treatment for this infection, but clinical trials have shown promise. So this is something like that still don't have cure, but there's still some hope that the scientists can find some cure against this sería, this problem with the that we have a lot in this in Cancun, for example, with the rains that bring the mosquito something dangerous for the people, and this can be very helpful for us. Next one is the liquid biopsy. And this is a simple procedure that avoids problems for the patient and saves times. The technique is not yet definitive in the early detection of cancer, so it does not replace other early diagnosis methods, but is complementary to them. Challenges include figuring out figuring out which types of tumors benefit more from applying it, and how often tests should be done. Okay, the next is robotic surgery. We know that robots are taking a lot of jobs in these years. So surgeon is something that the robots are now doing. So uh, in the in this text says that the robots are operating since 1980s. So the first robot used was the Da Vinci robot surgery system with 4 arms at the beginning of the 21st century. That is possibilities were expanded, making it one of the best technological advances in health that lead us to talk about intelligent operating rooms. It's already used in neurologic, gynecological, urological, or cardiothoracic procedures, but also in other surgical procedures. It makes interventions more comfortable and more precise, especially the most complex and difficult to access, overcoming the limitations of laparoscopic surgery. So basically, the robots are now more important because they are doing things like the humans. For example, the surgeon, or now they are robots that are nurses in the hospitals. So they are very helpful. For the Mexico part, only I can find or say that in Mexico the advantages of Ministry of Health have very benefited Mexico more than anything in the aspect that now in public institution 1 million Mexicans are treated daily in more than 24,000 medical units through the country.
Blood donation. Many things have been achieved after the pandemic. Another example is that during the year 2021, Mexico reached more than 1 million units of blood and blood components nationwide, which were obtained through voluntary and altruistic donation. Exchange of experiences between Mexico and Brazil to combat obesity. Another very important factor is that during 2021 the project was concluded with the aim of contributing to the reduction of obesity and overweight through the promotion of an adequate and healthy diet, as well as the strengthening of the technical capacity of both nations to improve prevention and control action for both diseases since many of those who were infected with the COVID-19 virus were overwhelmed. Health Month. During October, Border Health Month was held with the aim of promoting healthy lifestyle through various activities aimed at the general population and health personnel in partnership and collaboration between the public and private sector, academic and civil society organizations. National Health Week. Every year National Health Week (CBS) is held, which consists of the mobilization of efforts by community organizations, federal and state agencies and volunteers to improve the health and well-being of the Latin American migrant population in the United States in 50 states of the American Union.